So we've had a total of 15 patient transfers so far. We have 10 patients currently on the ship. So that's just in the past 4 days, which means we discharged 5 patients as well. And I think the take-home message there is that we are able to actually bring patients aboard and also discharge them effectively to generate that patient throughput so that we can continue to effectively act as a relief valve for the local hospital. If we were not able to discharge patients effectively, we would essentially fill up and then no longer be of any use to the local hospitals. So I think that's a good news story for us. Hopefully understanding the intent of DoD senior leadership that they really wanted to get the capability and capacity in place early before the hospitals in the local areas were already overwhelmed, so that we could establish the relationships and ensure the processes were sound to get patients to the ships, so that when the capacity demand really increases, we'll be ready. We've had a pretty broad range of medical and surgical patients come to us. In terms of the process to ensure that patients who come to us are not infected with COVID, we are not performing that test here. The local referring hospital is actually screening and testing the patient before they are transferred. We had a lot of measures in place to make sure that we remained a COVID-free ship. We did screening for everybody before they came aboard. After they came aboard, we've been doing all the individual measures that you're familiar with. And then, of course, all of our patients are screened and tested for COVID prior to coming on the ship. So we think we have a pretty robust group of measures in place to remain COVID-free